Welcome back. For years, Robert F. Kennedy Jr. has used false and misleading claims to undermine public confidence that vaccines, especially childhood vaccines, are indeed safe, which they are. During his confirmation hearing to be head of the Health and Human Services Department in January, Kennedy testified that he was neither anti-vaccine nor anti-industry, despite his decades-long anti-vaccine record being quite well documented. And now in his new role, Kennedy has been, predictably, chipping away at vaccine policy and research. Last week, RFK Jr. fired all 17 members of a Centers for Disease Control Vaccine Advisory Committee that makes recommendations on who should get certain vaccines and when. Kennedy went on to name 8 new members to the panel, 2 of whom were paid to be witnesses in trials against a vaccine maker. Last month, RFK Jr. announced the COVID vaccine will no longer be recommended for healthy children and pregnant women. This prompted a top CDC COVID vaccine advisor to resign. And now this week, Dr. Fiona Havers, a leading scientist and vaccine expert at the CDC, has also resigned. In an interview with the New York Times, Dr. Havers warned, quote, "If it isn't stopped and some of this isn't reversed, like immediately, a lot of Americans are going to die as a result of vaccine-preventable diseases," unquote. An HHS spokesman responded to the Times that it's committed to, quote, "following the gold standard of scientific integrity." Dr. Havers joins us now. Dr. Havers, what was the tipping point for you?
So there were a number of events that led to my resignation. There were 2 main ones. One was that on May 27th, RFK Jr. announced that the CDC recommendations for COVID vaccines were going to be changed. No one at CDC involved in vaccine policy was involved in that decision. He unilaterally announced a change to the immunization schedule on X without our involvement. And a change to the CDC recommendation schedule is important because if it is on the CDC's recommended immunization schedule, insurance covers it. So this is potentially denying access to COVID vaccines for people that may need them. Second of all, when that happened, I considered resigning at that time. And there was some pushback from within CDC, and what was eventually changed on the schedule was not quite as bad as what was announced on X. But so I was sticking around then. We have this vaccine policy meeting where a COVID vote was supposed to occur next week, and I was scheduled to present at that meeting. So I thought I could stay, maybe do some good staying at CDC within this setting. Even though this was unprecedented interference with the COVID vaccine policy process. However, last week when I heard that he had fired all 17 members of the ACIP committee, at that moment I knew I was done.
Yeah. So you have warned that if this isn't stopped and some of it reversed immediately, a lot of Americans are going to die as a result of vaccine-preventable diseases. What's your biggest concern for the health of Americans right now?
I'm a physician, and I've seen people die in the hospital of vaccine-preventable diseases. And I think that if this interference with the vaccination recommendation process continues, if the vaccination recommendations are more restrictive, Americans will no longer have coverage, and vaccines will no longer be paid for. And people that need vaccines will not be able to get them. We're going to see an increase in measles outbreaks. We'll see babies dying of pertussis. We'll see older adults dying unnecessarily of influenza and COVID-19 because they were confused about what vaccines to get. I also think that an increase in vaccine misinformation is going to be harmful to the Americans because if vaccination rates drop in general, more Americans are going to get vaccine-preventable diseases, and it's really that's very concerning to me as a physician.
Do you think the American people can still trust the CDC for reliable, accurate medical information?
I would say that the data coming out of the CDC is still very good. As of a week ago, I ran a large hospitalization tracking system where we tracked COVID and RSV hospitalizations. And we did that with state health departments across the country. That data is reliable, and I was going to be presenting that data publicly. My concern is how that data is interpreted and whether or not they even pay attention to the scientific evidence that usually goes into vaccine policy recommendations. That's my concern, that the people making the decisions and looking at the evidence won't actually be evaluating it properly.
What would be signs that we can't trust the CDC anymore? What are you looking for before you sound the alarm about the reliability of what the CDC is saying?
Well, I think the vaccine policy recommendations are in jeopardy right now. The change that was made to the CDC immunization schedule a couple of weeks ago that was announced unilaterally by RFK Jr. on X without CDC's input were not the recommendations that would be coming out. I will say that those recommendations potentially restricted access for healthy infants to get COVID vaccines. And that is a group that is at high risk for hospitalization. I know this because that's the data that the hospitalization system that I used to oversee collected. And so I think I'll really be looking to see how these new committee members, who are really not the people that would normally be chosen to be sitting on this committee for the most part, what kind of questions they're asking, what actually is presented at the meeting. Yeah. I will say for my CDC colleagues, many of us were viewing this public meeting as a last chance to get data out, get the scientific evidence upon which vaccine policy decisions be made out into the public sphere. But what this committee, now that they've fired all of the sitting experts with all the institutional knowledge, all of the background that we normally making these decisions, now that they're all gone, I have no idea what the meeting's going to look like.
Dr. Fiona Havers, thank you so much. Appreciate your coming forward today. Appreciate it.
Thank you.